blades on.
Okay.
So what you need to do on this, is there's a little bit at the top that you need to just grab, and then you can twist this round. Yeah, you twist that round, and it opens up the bit up at the top. Once that is open, then you hold this. Now usually you have to hold one of these. This is a suture holder. It's called a cryo wood, but you don't need to worry so much about that. You just call it a suture holder. That gets placed into the space in there, and then you can tighten it back up.
Have you got any spares?
Of this,
Yeah, the actual
you
blade.
can have this one.
Yeah, cool.
You can have this one because it can't be used on a patient now. So that now is a scalpel blade for cutting things, right? So if you look at this, it's got 3 sides on it. So it cuts on that side, it cuts on the end, and it cuts on the other side. You have a look. It cuts on 3 different sides. All right. So one of the reasons why I wanted this in the kit is because I wanted a scalpel blade that cuts on 3 sides. It's super useful, and I'll show you why in a moment. The other one, let me just see if there's spare in here. Called a 15C. Right, so it's got a very small cutting angle, can only cut there, cuts at the tip there as well, and it has a little hook kind of cut out of it. And the reason why it does that is because there's also 15, this is a 15C, which I'll give you this as well, alright? But basically, a 15 blade goes all the way to the end, and it doesn't have this little U shape in it.
Okay.
And the reason why it doesn't have the U shape is because it gives you more precision that you're only cutting on this bit, rather than the blade going all the way down there and you cutting all the way down to there. Okay, so that also goes on here. Now this is more tricky to place on. So what I would do is I would leave these blades on.
Right.
Right. So if you've got the demo kit, we'll leave the blades on them. Just be careful that you don't stab yourself when you pick it up. All right, because putting it on and off is that kind of separates somebody who's been doing this for a while
Okay.
and people who haven't been doing it for a while. Okay, so that's the 15C. All right.
Yeah.
Okay,
It's
so
even on there, isn't it?
so that's an SM69. This is a 15C blade. Okay, so both of these you're going to use for this kind of thing. So if we go to this one first, all right. So what cuts it up? That one. Okay, so for this one here, you're going to be using this, which is the 15C, okay, on the light pink one. All right, so we'll mark it down the bottom just so you remember, okay? The cuts are already there because I don't want you having to do the cuts and stuff, okay? So what you're doing here is, if you imagine the gum is closed, all right, and you're either going to be placing an implant in, or because the patient's got no teeth and you want to give them teeth, or they've got rotten stumps of teeth underneath the gum and the gum is closed over the top.
Okay.
So you want to be able to access that.
Yeah.
So what you're basically doing is you make your cut down there. You don't need to go through this with them, but it just kind of just says that, all you need to do is say, look, if you've got buried teeth, right, or if you're placing an implant where it's healed, then this is, you can make this incision. This is called a crestal incision. Okay, so I'll write the name down of this. All of this stuff I'll write down on the paper, okay? So what you're doing is you've got that incision there. Now, you're going on to your Xingheim, which is this.
Yes.
Okay, so from the Xingheim, what you're doing is peeling back both sides, okay? And the reason why you're doing it is because you want to expose that site there. So the Xingheim helps you peel it all back, and then you've got that site exposed. I mean, it's a hell of a lot harder in real life, but it gives the idea. Okay, so this one goes for that. All right. The other type of cut that you might have is that you might have teeth that are around here like this, but they're so rotten that they need to come out. So you've got all of this kind of section around here. Okay, so I've made a small cut around here and a cut around the gum line. So all you just say to them is, so this one is obviously where you've got buried teeth,
Yep.
or if you've got implants that you're placing in. Okay, this one here is if you've got severely decayed teeth, okay, but the teeth are still present, you can still see them. Okay, so what you've in effect done is done the cut here and around the gum line, And what you're using is this instrument. This is called a boozer. Okay, so it has two ends. It's got a sharp end here, like an arrow, and it's got a spoon end on the other side. Okay, so the sharp end is to lift up these triangle bits of the gum. So you use that, you've done your cuts, then you push this underneath, and that lifts the gum up. Okay, then you turn it the other way and push it like that, and you've exposed that entire tooth, and you can take the thing out.
Right.
Okay, so on this one, these two instruments. Okay, that one for the back, and this one for the front.
Yeah.
Okay, so we'll write that down in a second. Now, if we go on to this one is a similar situation to this. Okay, so you've got buried roots, you know, bits of broken tooth down the bottom, or you're placing an implant in. Okay, but you're doing a slightly different cut. Now, the reason why I'm doing a slightly different cut is to keep the edge of the cut away from the roots, to allow healing.
Right.
That's all you say. Don't go into how it heals or anything. Just say, in order to improve healing, you're keeping the edge of your cut away from the site that you're working on. Okay, and that's where this one comes in. Okay, so that for that, this for this. That's why I did it on two separate ones. Okay, so with this one, we're cutting round, and all you have to do is just go round the cut that I've already done, because it shows that because it's three-sided. You know, with this one, I've done a cut like that, and then a cut like that, and then a cut like that.
Yeah.
Okay, but on this one here, you need to have a more smoother flow. So you're going in and round, and then round again. So you're cutting from
One motion.
exactly. So it's all the way around. So now you have this, right? So once you cut that, this is when this comes in. This is called a curved raspiratory. This is my favorite instrument. So all you do is hook this underneath here, and then start stripping the gum back, and it's exposed, your whole site. The main reason why we do this, obviously don't go through this there with them, but the main reason why we do this is because if you've placed some implants in here and your wound breaks down a little bit, the wound breaks down around the edge, and your implants are miles away from the edge, so you're always safe, right? But this is a really neat little thing that basically they can just do their cut, lift it back, the site's exposed. Okay, so that's that one. The other ones here are this one, which is the molt. So I've done another cut here, but I won't worry about that. Leave that one alone. The only other cut that you need to look at is something like this. So if you look at this first, can you see how this is all broken?
Yeah.
Around here. So what you want to do in this case is replace this tooth, so you're like placing an implant, but also at the same time you need to expose this big void down here. Okay, so what we've done is done the same cut, you know, with those pointy bits in between the teeth, like that.
Yeah.
Yeah, so we've cut along that with either blade, and then you're using this to lift up the edges there, and then you turn it round, and then you're scooping underneath and scooping and scooping and scooping, and then you pull it back, and you've exposed that defect.
Yeah.
Right? So you've got this instrument, which is called the molt.
And you did the cut with that one, is that
Yeah,
right?
and what I would do is I would separate it. So I would do it like that, right? So using that to cut on this one, and this one to lift the gum, and this one for the back area here, and on this one use a three-sided one to cut, and then use the respiratory and the molt for the other two.
Oh, right.
Okay, it just simplifies things. So that's all you just show them. So just remember, always when you've got these instruments which are two-sided, the pointy end is for the pointy bit in between the gum, and the other end is for scooping the gum away on that side, and it's kind of shaped like that. Can you see where it goes in and then it comes around like this?
Yeah.
So this bit is sharp.
Yeah.
Okay, so when you run it on the bone, it peels the gum back away from the bone, and this bit is rounded so it doesn't cut you